And we're back, like we never left, right? Hey, I'm Darren Brown, and I want to thank you guys for joining us on our another episode of the Cheyenne and Arapaho Productions podcast. What we try to do here is talk about all the cool things that are happening at the Cheyenne and Arapaho tribes, and I'm so glad to have the folks from the Cheyenne and Arapaho tribes Diabetes Wellness Program. Say hello.
Hello.
Hey, all right. Okay, we're so glad you guys are here. Let's you go around the room and we'll introduce yourselves. I'll start with you, sir.
Marcos Baros, and I am the Diabetes Wellness Program Director.
Raven Bramlett, Healthy Lifestyle Specialist.
Kyle Gilbert. I'm the fitness coordinator.
All right. Well, the first question is for you, Marcos. It's a long. Well, no, you don't have to check the tribes, but just the Diabetes Wellness Program. Everybody knows, I think, what the BETUS is.
Yep.
But you guys do so much stuff. Can you guys give an overview of what you do at the program?
Yeah, so basically what we do is we provide services for our clients that are diagnosed diabetic as far as like maintenance and trying to revert that back into non-diabetic. And then we also have our prevention side, which focuses more on the prevention of diabetes, since pretty much any Native American has a higher risk of diabetes or getting diagnosed for diabetes. So we try to provide the tools and education for the prevention side of that. And then on the maintenance and compliance side of that, we offer case management services, eyeglasses, shoes, durable medical equipment, and nutrition counseling for our clients with diabetes, just trying to get them to where they can kind of create lifestyle changes to help them either revert their A1C back to normal levels to where they're no longer diagnosed diabetic, or kind of maintain, or not maintain, but kind of be more compliant to start making those changes.
Do you find that a lot of, like you said, it's, hey, all of us Native folks, we're predisposed to that,
Yeah.
Hey, thanks, Mom and Dad, and thanks to all the rest of y'all, But that's just the way it is. You got to deal with it. I mean, not just Native people, it's, African American folks as well,
Yeah.
So with that, it's there. It's not going away.
Right.
So do you find that a lot of your clients don't know that, or they just know it and let's just admit it's a hard thing to change your diet,
Oh, yeah.
Even if you're like in your 30s, even if you're still young, it's like it's not just a, that's the thing, it's not just a diet, it's a whole lifestyle change.
Mm-hmm.
But do you find there's a lot, there's got to be a lot of education in what you guys do, right?
Oh, it's primarily a lot of what we do is education. Our grant that we wrote is specifically towards diabetes-related education, mostly because we're a community-based program and not clinical-based. So, yeah, there's a ton of education on either preventing diabetes or trying to revert that back to normal standards. Going into, like, the lifestyle changes part of it, that's really the biggest thing, is because, going back to really kind of what really started the diabetes, especially among the Native population, was the commodities.
Yeah, the introduction of foods that just we were not ready for.
Yeah, absolutely. So now we're going away from, or we went away from our culturally known foods, what we were used to for the whole time that we really didn't have those issues, to having a whole set of new foods introduced to us that started causing those health disparities. And so now we're so accustomed to the way we've been going for the past couple 100 years or so. Not really 100 years, but 50, 60 years, that we're like, well, that's how it's always been. But
yeah, and not only foods that were brought in, introduced to us that were not what we were used to and our bodies weren't used to, but just in the past 10, 20 years, food, let's just be honest, food companies, they're trying to find a way to make it cheaper and easier, and that just means more stuff.
Yeah.
More of the bad stuff, and less of the good stuff inside, right?
Yeah.
So you folks, I know, Raven, you deal with this on the education side too, right?
Yes. I do a lot of the nutrition kind of aspect of it. We have been working lately with doing food prep classes to kind of teach everyone how to prepare better foods, I guess. We really kind of like what we've done in the last like year and a half is we're not really looking at like totally changing, you can't eat this, you can't eat
Yeah,
that.
because that's the worst thing.
No.
Yeah.
You tell people not to do something, what are they going to do? They're going to do
Right.
it.
And so we're more into like food swapping, like instead of this, try a little bit of this. So stuff like that, just to make it a little bit easier.
Do you find that people are really open to that? Or do they just think, or do they hit you with, I can't do that?
Well, I feel like we have pretty good open. I try to make, especially like when we do boot camps and stuff like that, I try to make like kind of healthy snacks to have after that. And a lot of stuff are things that they've never tried.
No kidding.
And
Wow.
we get pretty good results from it that they're like, oh, wow, I didn't realize I'd like that.
Yeah.
Like hummus and vegetables and stuff like that.
I was that way with hummus.
Uh-huh.
It didn't look very good to me,
No.
but
I still haven't tried it.
oh, hummus, man. Don't take it from us. That's a good stuff. Hey,
It's delicious.
Kyle, so you're on the fitness side, right?
Correct, yeah.
The conditioning. Talk about what your job and how you work with this whole thing.
So really, I mean, a lot of the ones that do have diabetes, they're kind of not real fit anyway.
Sedentary.
So, yeah. So of course we're going to try to introduce them into some workouts, stuff based off their diet. Really just trying to get them moving again, opening up that blood flow again. I'm a certified personal trainer. We have a fitness assistant. She's going to be certified here pretty soon. We both have a few clients so far. Always looking for new ones. Yeah.
Is there a general? Do you have what's your predominantly like your main like age range? Would you say?
That we're seeing right now in the
Yeah,
gym?
yeah.
I'd say a lot of basically about 25 to maybe 40, I'd say.
Now, because we know, when we talk about diabetes, man, it can hit, early, especially if you've got someone who's, their whole family's like, obese to begin with, and they're not someone who's just not, let's say, in the know about healthy food, and let's just be honest, man, it's difficult to get someone on that healthy path when even if you go to a fast food place, the burger might cost you $2, but you want to get that salad, it may cost you double that. And what's up with that, man?
Yeah.
That's got to be changed. But I think if you want to get all organic and stuff, then you're going to end up paying a lot more money.
Oh, yeah.
Right. So you guys have to fight against that too, right?
Right, and we do have right now, we have a grant where we are able to provide fresh fruits and vegetables once a month to our tribal members. So that's been kind of a great thing because that is very expensive.
Yeah, and that makes a huge difference that people don't even think about. I had this discussion a while back. And so what if your whole life you had one car? Wouldn't you want to take care of that car? And put the right, check the oil every now and then, and put the proper gas in it.
Yeah.
Man, that's what we got with our bodies. It's like you've seen that meme on Facebook probably. It says, y'all folks have fun in your 20s and 30s, man, because when you hit 40, that check engine light going to come on, man.
Yeah.
And as in the people, what we do was keep on driving. Just put a piece of tape over, don't look at it,
Yeah, I think honestly that's the biggest thing too is like, again, going back like culturally to where we were like constantly on the move, constantly active.
Yes,
to,
yes.
Like now, present time, like we have cell phones, TVs, everything like that we didn't have back then. So it leads us to a more, like you said, sedentary lifestyle, and it just really takes a good push and some internal fortitude to really be like, yeah, I got to fix this, and I got to figure out how to fix this.
So you mentioned earlier, you talked about eyeglasses and shoes and stuff like that. Let's one of the things we have to talk about, when we talk about diabetes, man, I think you hear that word, you don't exactly, people know what it is, but they're like, okay, what does that mean? Well, that means if you don't take care of it, bad stuff can happen.
Mm-hmm.
And that's why you guys have that arm, I guess, of your program, right?
Mm-hmm. Yeah. So with diabetes in your eyes, you can get retinopathy, glaucoma. It can also increase your risk of getting cataract, stuff like that. So with our optometry side of things with the eyeglasses, we try to make sure that our clients have had their retinal eye exams within the last 2 years, which is within the American Diabetes Association standards. So every 2 years for a client or a yearly retinal eye exam for a person with diabetes. So we provide an eyeglass voucher up to $150 towards the purchase of the eyeglasses that we have on station. We go through Modernize and Dean McGee, and so we were able to offer prescription eyeglasses at a more discounted rate. The frames are normally pretty cheaper than what they would be if you went to a private eye doctor and stuff. So we provide $150 towards the purchase of those.
You have a lot of clients involved in that?
Oh, yeah. We got a bunch of clients involved in the eyeglass portion of that.
And the shoes as well?
Yeah, the shoes as well.
Talk about that.
Okay, so the shoes, again, one of the biggest things with clients with diabetes is proper footwear. You can't wear really anything that constricts your feet. Otherwise, it kind of opens you into developing sores or calluses. And your calluses will then...
And if you can't walk, you can't do your job. You can't do much if you can't get around well.
So with diabetes, open sores and stuff like that kind of are a lot harder to recover from, which could in turn lead to amputations and stuff like that. So with the wellness shoe portion of our program, we try to educate on proper foot maintenance, proper foot care, stuff like that to prevent those amputations. And so with the wellness shoe, we provide a shoe that kind of helps with the feet being able to spread out evenly. We try to provide wide shoes. We don't provide diabetic shoes other than, no, we don't have our Nike contract anymore, so we don't.
Yeah, that's a whole other.
Yeah,
it's a whole other. I see what you're saying. Yeah.
Yeah.
And talking about this stuff, it sounds it's not I'm not trying to scare anybody. We're just. I think the thing is though, people need to understand that this diabetes. It's nothing to play around with.
Right.
If you have a definitely a diagnosis of it, or even pre, or even pre, man, that just should be a wake up call, right?
Mm-hmm. Yeah. So we also have a diabetes prevention program that's a CDC. We're fully recognized by the CDC under an umbrella. But it's a CDC created program. It's a year long, and it basically goes into nutrition, physical activity, and basically keeping track of where you're at and where you need to be. But it's a year long course. But we have different avenues on which you can take that course, which Raven is in charge of that.
Yeah, we do. We can do in person. We also can do fully online. We utilize Google Classroom for that. But it also kind of goes into the mental aspect, because changing your lifestyle is definitely kind of a mental thing. So we hit that a lot. One thing that I was thinking about, when you were talking, is kind of a barrier we seem to find is, I'm just going to get it. Everyone in my family has diabetes.
Really?
I'm just going to get it. And that's just what's going to happen. I'm going to lose my leg. It's going to happen. And we're like, no, that's, a big push on us is this doesn't have to be this way. We can fix this. We can reverse it. We can stop it where it's at.
And I don't want to cut you off. We're going to get back to that. But I know when I first got here, when I first started working with these tribes, I was, interviewing someone about this same thing, and I knew that it was prevalent in the tribes, but I just didn't know, and I said, and I was trying to and ask, I said, I don't mean to sound stupid, it wouldn't be the first time, right? But I said, are you trying to say that you can reverse diabetes? Because to me, I was like, I just kind of thought it wasn't reversible. So you're saying that it is?
Slightly.
Yeah.
Okay. Thank you.
You
Thank you
can't-
for
Yes.
even starting with that. So let's just say this.
yeah.
Let's just say. I'm not saying that we can stop it and make it go away. I'm saying that we can stop the process and like get you stable, and then you can fix things, right?
Right.
Please explain that.
Yes, you can definitely get your A1C back in check. Pretty much be pre-diabetic. It's kind of like, I'll compare it to an alcoholic. You're
Yeah.
never not going to be an alcoholic.
And they're never going to not want to.
Right.
They're never going to
check
not have that
yourself.
temptation. Yeah.
Right. And check yourself. But you can totally get off insulin. 100%. You can, there's a million things that can absolutely happen. It does not have to go down a bad avenue.
Yeah.
Now, not to say there are special cases that there are people we know that, have a very healthy weight, work out all the time, eat right, and they struggle with their A1C. But that's not the norm.
But people need to know that it's not a foregone conclusion that once you're diagnosed, you're going to lose you're going to lose a foot. I mean,
Right.
I just that hurts me that people would think that way.
I know that that's something we really are trying to get out there, that it's not a death sentence.
Yeah.
It's not at all.
Kyle, jump in here, man. Talk about conditioning, man. I mean, because I think I'll help you out. And I'll just throw myself out there because I'm much older than you and you and you. But the thing is, sometimes when I work out, I'm thinking to myself, man, I can't what I used to do. But I'm thinking 20 years. Well, no, of course I can't do what I was doing 20 years ago. And then I think to myself, I get all discouraged. And then I think to myself, well, you know what? There are other dudes my age who can't even do what I'm doing. So you got to go that way. You got to think about that. But I know people who were pretty obese, and after like just 3 to 6 months of really diligent training, man, and proper nutrition, they dropped a lot of weight. And it's just, I'm amazed how our bodies will bounce back. First of all, it's amazing how quickly you can lose muscle tone.
Okay.
But it is amazing how quickly that your body will start working back to get back to where it was, right?
Correct. Yeah, that's wild.
Okay, Kyle, come on. You got to help us. Give us more. That's what do you see when you bring people in? I mean, do you run into folks who like worked out or were physical way back in the day, and then it just sitting around and caught up with them, or?
Yeah. We see guys who come in and, they always talk about how much weight they used to push, and then they come in and they kind of still want to try to push that weight.
Yeah, that's a bad idea.
Yeah,
I could tell you a story.
Yeah. And then there's a lot of people who they're just kind of scared to get back into it, or they've never done it before, so they're kind of
I can see that.
discouraged on it. And
That's what you're there for, right?
Yeah. I'll go sit with you. I'll walk you through all these exercises, just different variations of hitting this one muscle group, and whether it be we can start out real slow, just walk on the treadmill, and then slowly start inclining it, stuff like that. Just building a foundation, really.
Well, and when you talk about not even bodybuilding, but moving weights, I've read so much stuff. Here's, like I said, I'm old enough that my YouTube feed is full of so and so, fit after 50 stuff like that, because I am over 50. But hey, don't laugh, you'll be there, man.
No.
So, but no, I think the one thing that that people preach constantly is that, man, you got to lift weights. You have to do some sort of resistance training, and it's not about looking good, although that's great. That'll help. But it's just about our bodies are meant to do that, right?
Yes, I wouldn't say you had to really lift weights, but you definitely have to be moving.
Yeah, I mean, there's got to be some sort of resistance, right?
I would say so. Yeah.
Yeah, yeah. And so you said do you have like all ages coming in?
14 and up. Yeah.
Okay.
Yeah. Up until 18 have to be accompanied by an adult. But yeah, we have some younger guys that like to come in and get a lift in.
Mm-hmm. What do you find when you get someone who is, let's say, probably not acclimated to this, to lifting weights or even doing cardio? I know that luckily out here we don't have, it's not, I mean, not the same type of thing when you go into a big gym in downtown somewhere where you're going to run into everybody who's all wearing spandex and they know how to use the machines, and it's not like that here, right? What do you do to help put these people at ease?
Well, first, I mean, we need to figure out what their goal is. Are they wanting to lose weight? Are they just wanting to tone up? Are they wanting to actually like build muscle, stuff like that? And then we go into it. So as far as someone who, is new to it, again, just walk them through everything and then stay there and do the whole workout with them. That's what I'm there for.
Do you find, and I think this is an age-old question, but some people say, well, I just want to lose weight, and some people say, well, they want to say, well, I want to lose weight and build muscle. What do you tell those folks? Because it's kind of it's not, they don't necessarily go hand in hand, right?
Correct.
What do you tell those folks, and how do you explain it to them?
Well, it's not just about working out, though, either. If that is your ultimate goal, is to lose weight, but also build like muscle, that's where nutrition comes into.
You're never going to go wrong with building more muscle, I don't
Right.
think.
Yeah. So
Especially the older you get, man.
I think really with that too is like weight is held different.
Yeah.
You know what I mean?
Yeah.
So like, for example, right now I'm like the heaviest I've ever been, which really isn't a whole lot, to be completely honest. But
We do have cameras.
yeah. So I mean, I'm sitting at like $170 right now, which is the most I've ever weighed. But like to me, like I don't like my pant size is probably the largest that I've been in, as opposed to when I first like started working for the tribes.
A lot of meat pies, man.
I know that's what meat pies and then tacos, all of that.
Yeah.
But looking at it, like I've weighed close to this before, but my body fat wasn't anywhere close to what it is now. Like I was still on like in the teens for my body fat percentage, whereas now I'm close to 30%, I'm pretty sure, last time I checked. And so like you hold weight differently. You could weigh 175 and be muscular, or you could be 175 and have a gut and double chin and all that good stuff. It's just really dependent. So with the losing weight and building muscle, that's just really just like a recomposition. It's just taking that fat, turning it into muscle. You may still weigh the same, but you're going to hold that weight different. Your pants aren't going to fit. Your shirts aren't going to fit the way they used to. So it's kind of how he said, it's really what you want to do.
Yeah.
That nutrition takes a big role into it. But kind of going more into the gym is like an intimidating place.
It can be.
I used to hate
very
like,
much so, yeah.
getting forced to been like, oh, you got to go lift weights. And I'm like, oh, well, I don't know what I'm doing, first of all. So
I don't know I don't know. Should I start with this weight or should I,
Yeah.
Am I don't, here's a tip. Don't start with your max. Don't do that.
Yeah.
But you don't know what a max is if you're just getting started.
Yeah. So one of the things that we do at the Diabetes Wellness Program is we try to foster more of a inclusive and friendly atmosphere, especially like for those new folks coming into the gym. If somebody walks in, they're automatically greeted. If they're new, we take them into the gym where they'll be introduced to Kyle and Corey, and Kyle and Corey take over it from there. And Corey's our fitness assistant.
Yeah, she couldn't make it today for whatever
Yeah.
reason. So, hello, Corey.
Yeah,
We
hey
miss
Corey.
you. Shout out.
So she's our fitness assistant. So they'll get introduced to Kyle or Corey, and then they'll take over from there, and they'll figure out what the client really wants to do, and
nice.
what kind of exercises or nutrition tips or educations that they need. And then from there, like they'll instruct them how to use each piece of equipment that's there properly, safely, of course, not going straight into the maxes to start off and everything like that. And then kind of going back into with, how quickly your body just starts going into that sedentary
It's
state.
a good sore.
Right, yeah.
It's
So
sore, but it's a good sore.
generally, like, your body starts adapting back into a workout routine within 2 weeks. They call it muscle memory.
Yeah.
And so within 2 weeks, your body kind of gets really adapted into whatever workout routine that you were doing. But it's really, like I said, just getting into that, like, internal fortitude of, like, man, I got to get in there and make these changes and stuff. Like, I'm gonna be honest, I work in the gym, and I've had one workout this year, and that was
Well, it's early. It's early.
January 2nd, wasn't it?
I think so.
Yeah.
Was it full that day?
Yeah. No. To be honest, not really.
Yeah.
Well, and we were talking about weight and stuff, and I think we need to make sure that people get away from it. Just your actual weight, the lbs, that doesn't determine everything.
Oh, yeah, absolutely.
Like just like
not.
what you
Yeah.
were saying. So don't go just like people. When you're sick, don't go online first. You can freak yourself out.
Absolutely.
Go to the doctor, let him or her, explain what is going on. Just like, when you need to lose weight, it's not all determined by your scale. I mean, like you said, the distribution and body type and so many factors can determine. Well, man, that's a whole other show. Really. I want to talk about. There's so much stuff that you guys got going on. Who wants to talk about the mobile portion of what you do?
Okay, so
Hey, look, May, it's the Marco show.
2020, the tribes purchased a mobile medical unit.
An MMU, baby.
Yep, and we actually call her Moo Moo. So with that, we got a partnership with the Indian Hill Service, the Clinton Service Unit, and they actually provide us with a doctor, a nurse, lab tech, and an MSA to make sure all the information is up to date on their charts. And so we go out to 6 different communities with the mobile medical unit and basically try to take IHS to those communities, especially for those that can't make it to Clinton, El Reno, Watonga. So we try to take the doctor to them.
Talk about what kind of response you get. I'm
So
sure it varies.
It really does vary. One of the biggest things is which programs are also in attendance. Transportation is also a big thing. Like, even though we're taking the doctor to them, there's still a transportation barrier with taking those clients to those locations. But in all honesty, it's kind of growing quite a bit.
You've been around, what, going on 2 years, you said?
2 years, yeah.
Okay. This will be year 3, I guess. I think, maybe?
2024, yeah, it'll be
Okay.
year 3 because we started in at the end of 2021. 2022 was our first year.
And I think I see the flyers and I see the stuff on social media, but I still, it's just something like this. People got to know. I mean, and the thing is, we forget, if you live, I mean, and I've said it every show, since we are in Concha here, we're on the eastern edge of the tribal service area. And if you had those folks who live in those tribal towns out west, and transportation is an issue, then hey, somebody's trying to call me. I'll call you later. But if you have transportation issues out there, 100 miles really probably feels like 300.
Yeah.
So and I think, but like I'm glad you brought that up. But even though you're going out from Concho to the other tribal communities, you still may have someone who's 50, 60 miles away and has no way to get there.
Yep. So that's also another thing that we have going on. And we have with the mobile medical unit, we have partnerships with all our Department of Health programs that come in and hop in with that. So our CHR's community health representatives, CCR's community or COVID care response or something like that. To be honest, I don't know. Sorry,
Can't think of
CCR's.
it right now.
They both do kind of transportations, and then the EMS wheelchair van.
Okay.
they'll assist with transportation as well. So here with this year, what we're going to be doing is we're going to be adding a transportation number to call
Okay. Nice.
to our flyers and stuff. So if you do need transportation, basically you'll get a hold of Kyle. Kyle will develop or coordinate. Thank you. That transportation with whichever program is going to be in attendance of that mobile medical unit. That time.
So, and I apologize if I missed this. Did you say are there set communities that you go to, or does it rotate?
Yeah. So we hit 6 communities with one community each month. So January we hit Canton, February Hammond. I'm not going to go in order for the rest of these because I don't remember.
I'm not going to make you name all of them, but there are 6 communities that happen in rotation every month. Okay.
Yep. So
we have still got to make it out with you guys to one of those. We've talked about it for a long time, and I apologize we haven't made it out.
You're good.
CAP hasn't made it out. We will. We want to promote every. Our mission is to promote stuff that's happened here at the CNA tribes, and we can only do so much.
Right.
We got a small staff, baby.
Yep.
But everybody here does, right?
Yeah.
So,
I did want to add one thing to that. With the transportation part, we will also provide prescription. So if you need to go pick up a prescription because the doctor said we're going to take you to go get a prescription.
yeah, you can't just write a prescription. Say,
Right.
okay, good luck.
Yeah.
So we're really kind of developing that and trying to push that out.
Nice.
That we have a lot of services now that we're able to provide to get you out there.
Man, see, now we're getting somewhere.
Yeah.
We're getting to the meat of it.
Yeah.
One thing I wanted to ask you guys about, and I know we're months down the road, is I saw a flyer for Rise of the Tribe.
Oh yeah.
Is that you, Kyle? Oh, it's Marcos. Golly. Marcos is singing again.
Yeah, that's my baby right there.
Okay. Well, explain to folks what it is.
Okay, so Rise of the Tribes is it's a fitness competition between tribes. Myself, when I was the fitness assistant, and the Wichita and affiliated tribes health programs fitness trainer kind of got together, and originally we were just going to have a gym versus gym competition, and we kind of started talking a little bit more. Got a lady who worked for the Lawton Indian Health Service involved, the Delaware tribe involved, and we were like, let's just make this like kind of borderline CrossFit competition, and just kind of rotate it around. We'll have like a trophy going with it, so whoever wins gets the trophy, and
Bragging rights.
Yeah, bragging rights for the year, So we developed this competition and health fair, and we started that, and it was pre-COVID.
Yeah, I think you're right. Yeah.
And actually, Kyle was on my team that year.
Year
it was
one.
2019 actually was the
Yeah.
first year that we had it. Yep. And so year one, the Cheyenne and Arapaho tribes won that, and we've been chasing that first victory ever since. But yeah, it's open. When we first started it, it was like a 6-person team. We since realized that's kind of hard to fill. So we went down and we dropped it down to 1 male, 1 female team, whereas one person on that team has to be a tribal member. And so now it's open to that 1 male, 1 female team. So we've kind of grown quite a bit from when we originally started. We only had, I think, 3 teams competing that first year of 6. And then when we opened it to 1 male, 1 female, we had probably 6 teams, if I remember right, that whenever we got past kind of the COVID stages of that. And now last year we had about 10 teams signed up and ready
Okay,
to
here's my
compete.
question.
Yeah.
When are you going to put in age categories, Marcus?
Man,
Because I got to be in the golden age.
that's something that everybody's been asking, because they're like, I don't want to be 60 years
yeah,
old.
exactly.
competing
You don't
with
want
an
my
18-year-old.
You don't want my old behind competing against this guy. That just ain't going to happen.
Hey, but listen. All right, and here's my response to that. But
Let's record it. Make sure we're recording it.
We will be looking into the age thing, but my second year competing, I was about, let's see, I'm 32 now, so 30 at the time, and we beat some 18-year-olds. So, and my joints ain't what they used to be. So
I'm just telling you, there's a difference between 32 and 18 and 50
And
blah, 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 and 30.
yeah, I mean, we can get you on our level. It just takes a little training. We'll get you there. We'll get you ready. It's in April.
Yeah, sure, man. Checks in the mail.
Yep.
But real quickly, tell people what's involved in it.
So this year we got 6 rounds of workouts, ranging from body weight workouts to workouts that actually require weights, like a farmer's carry, deadlift. We got a bear crawl with dumbbells. We got overhead press, body weight side. We got.
So you guys ain't playing around, huh?
Oh no, not anymore.
This isn't just do some jumping jacks and call it good, huh?
Yeah.
Hey, if there's jump roping, I'm in. Okay.
Yeah, I'll be honest. You really got to train for it though, because what year did we have it out at the Powell Grounds? It was when you first started. Yeah, 2 years ago. We had it at the Powell Grounds, and I did a little bit of training for it, not a whole lot. And we did a video on showing the exercises, and I was pulling the sled, and it was easy when I did that video. But when it came down to actually doing the competition, man, I let my teammate down because everybody finished within like 4 minutes for their team. My team finished in 10 because I couldn't move that sled for nothing.
There's a little rock.
Yeah, there was a rock in my way, and that's what we'll blame it on. But
well, what else do you guys have planned for the near future?
Perfect.
Hey, we got a list.
I've got a list.
All right.
So this is kind of February, but we can go into that. We've got a weight loss challenge that actually is starting this week.
Oh, that's right.
Yeah. So that we've got 2-week weigh-ins for that. We do walking club every Wednesday at every Tuesday at Respect at 4:00. We're actually having a February squat challenge that we're going to have.
Don't look at
Kyle's
me.
doing.
Don't look at me. Last time I did that, I died.
We've got meal prep classes coming up. We've got one in Concho on the 5th, one in Clinton on the 12th, one in Watauga on the 26th. We have a health awareness powwow coming up in Canton on the 10th. We have a Watauga Community Care outreach on the 10th also. Then we have a Valentine's Day walk at the Buffalo Trail on the 14th.
So nobody can accuse you guys of being lazy.
Yeah.
I would never do that. Who would do that? Who would do such a thing? Kyle, are you involved in all these, or there's other stuff there? There's stuff that. Let me ask you this. I'm sorry before you start talking. I was talking with the folks from Respect just the other day, and they had is that the strength thing? Are you guys working with them with the strength and conditioning thing?
Yep. So I really enjoy working with youth, and I have a certification in lifespan coaching, which covers youth to seniors. And so one of the things that we've been working with Respect on is strength and conditioning for sports. And it's all inclusive for the youth. Second grade and up ideally is what we go for.
And the way they talk, it's been growing.
Oh, yeah. I think the last week that there was about 45 kids there.
So how great, I mean, hopefully you can squeeze in some diabetes prevention in there,
I mean, so
get
honestly,
these kids in the know to begin with, right?
So with physical activity, that's one of the biggest things that we push is like, you can have fun, be active, but this is really like one of the biggest tools to preventing diabetes. Mm-hmm. And so, yeah, we really enjoy that class. Speaking of physical activity and being active, I don't know if any of y'all seen it in the El Reno paper, but we have received a grant from the National Fitness Campaign.
Hold on. Oh, I can't find my effects. Oh well. Oh no, hold on. That's what I was looking for.
Yep. So we received a grant from the National Fitness Campaign, and basically what that grant is for is to provide funding towards the construction of an outdoor fitness court.
Now, okay, hold on. How cool is it? Tell me more.
Okay.
Tell me what you were talking about, an outdoor fitness court.
Okay, so an outdoor fitness court is basically an outdoor fitness gym without the weights and everything. It's all constructed equipment that's on the court itself, and it covers 7 different aspects: pushing, pulling, core. It's got like boxes for box jumps or step ups, stuff like that. and it's all like super easy to use. It's got instructions for everything. We have there's a mobile app on there that you can, just scan that QR code, pull it up, and it'll show videos of how to properly do this or exercises, or it's got like whole workouts for you to do, stuff like that. And so right now with the grant, we're looking at building one at Adams Park in El Reno and at the Geary ERC. Basically just taking these out to the communities. It's going to be a multi-phase project. So 2025, we're going to apply for another grant again. Hopefully we get that, and we're going to continue to build these out in the communities to make sure like we're providing more tools for our communities to be able to prevent diabetes.
That's awesome.
So, and
That is
We'll
a
be
really
inviting
cool
you guys
thing.
out too for that.
Yeah. Well,
yeah, so that's
then you say you buried the lead there, man. How it happens.
yeah.
I can't. Many times I've done this, and well, we're wrapping it up. You got one more thing? Oh yeah, let me tell you about this. Oh,
Yeah.
I totally forgot. Well, did I miss anything? Is there anything that that's happening that you guys wanted to get across? It's now or never. No, it's not.
So, no,
If there's
no,
more
our
stuff, we can always bring it
message
back at
is
some point.
prevention.
Yeah. And like I said, you don't, I think, like you said, you don't, you get that diagnosis, don't freak. Let us, come, talk to us, and we will help you through this.
Yeah.
Right?
Yep. So with that too, we just opened up our kind of service area. In a sense, our Cheyenne and Arapaho tribal members, regardless of residency, if they're diagnosed diabetic, they can receive our services. Any federally recognized tribe still has to be within our 10-county service area.
Okay, now say that one more time.
So any Cheyenne and Arapaho tribal member who's been diagnosed diabetic, regardless of residence, can receive our services. They'll still have to come in to do our consultations and stuff, but they can receive our services. Because one of the things that we ran into, and we were under the impression that other tribes' SDPI programs were the same as ours, which SDPI is our diabetes grant, where they serviced any federally recognized tribe within their service area, because that's what we did. Came to find out here not too long ago that actually wasn't the case, that they only serviced their tribal members. So we were kind of turning away some of our tribal members and like, no, they'll help you out down there. Turns out they didn't. So we kind of re-looked into that and then just decided, you know what, let's go ahead and open that up. So we opened that up.
So it's open to any tribal members. Is that
Anywhere.
Anywhere?
Anywhere.
You're talking
Nebraska.
Okay,
So-
Yeah.
I was about to get that, but you said also it's available to federally recognized tribes
Mhm.
only in
Only
this.
in the 10 counties.
Okay, thank you.
Yep.
Okay, all right, and that's what I thought. I just want to make sure we get that clear.
Yep.
All right. Well, guys, thank you so much for being on here. It's been informative, and if when we get done, if you next week you remember something else, we can work another thing. We can get you on again, and certainly, I know it sounds like you guys got some really great programs going on for helping the folks here. So with that, I want to say thank you. Ha-ho! Thanks for coming in, and we will see you guys next time on the Cheyenne and Arapaho Productions podcast.
Perfect. Thank you.